I would like to briefly introduce Dr. Stephen R.T. Evans. He has worn many hats in his lifetime, and I just want to highlight a few. He received his medical degree from the University of South Florida College of Medicine, completed residencies in general surgery and obstetrics and gynecology at Brigham and Women's Hospital, MedStar Georgetown University Hospital, Harvard Medical School, and a fellowship at Georgetown's Lombardi Comprehensive Cancer Center. He has been a director of the American Board of Surgery and became the chair of the American Board of Surgery in June of 2015. He is the Executive Vice President for Medical Affairs and Chief Medical Officer for MedStar Health. This hospital system is comprised of 10 hospitals and 20 other health-related businesses across the Maryland and Washington, D.C. region. He oversees the medical education, research, clinical quality, and risk management initiatives for the system, as well as the academic partnership with Georgetown University School of Medicine and MedStar Health's other academic affiliations. Dr. Evans is somebody that has inspired me beyond just being a resident. When I first met him at the Georgetown interview, and I remember the moment distinctly, the words that he said to me have stayed with me and are words that I've repeated to others. And what he said to me was, "We are going to hire you as who you are, and there are parts of you that we will change, and that should be related to you as a surgeon, a leader, and an educator. But the foundation of your personality, that is something we should not change." And I think for people that know me, they understand why he said that. And he said to me, if we ever change who you are with respect to that part of you, we have done a disservice to the surgical field. And I think it was that moment, if no other moment, that made me say, Georgetown is where I want to train and where I want to be. And when I was a resident with Dr. Evans and he was no longer the chairman, he still was an integral part of my learning to be a surgeon, a leader, an educator. He has been a mentor to this day from that time, and I think he's always the first person I think of when I think of changing my practice or starting a practice or wanting to get additional training, anything in respect to how to be a better educator, leader, and surgeon. I think of Dr. Evans and I reach out to him, and he's always been there for me. He has given me a passion for safety and quality improvement that I didn't know I had within me, but he definitely was the reason why I identified it, and it is still at the forefront of my practice. Not only that, but he represents the type of educator I want to be, and that I, try to be every day, whether it's with students or residents, or even staff such as nurses who ask me questions. He is a surgeon to the highest standard, and I think I always want to make him proud when I'm operating. Not only that, but he is the epitome of what a leader should be. He knows how to lead people, and it's by just being himself, and I think that's a quality that not every leader has, but he definitely exemplifies. And so for these reasons, he is somebody that I wanted to choose to hopefully inspire residents throughout the nation who are in a surgical practice and environment and looking to the future. So I hope this video is enjoyed and helpful to those that participate in it. What motivates you to get out of bed in the morning when your alarm goes off?
I think what motivates everybody is the opportunity to make a difference, and that's to make a difference in our patients' lives, or make a difference in the hospital, or make a difference in the healthcare system, or make a difference in your medical group. But I think everybody wants to make a difference. I mean, that's fundamentally why surgeons chose surgery, is that the opportunity to make a difference acutely is very pronounced. And so I think that is probably the biggest, most important reason why I stayed pretty motivated, pretty energized. I think that captures it, I think, for most surgeons.
And what is your favorite memory from last week?
So, I was on the tennis courts with both of my daughters are tennis players. So they were both on the tennis courts in matches playing last week, and there's just about nothing more gratifying than watching your 7 and 10-year-olds playing really high-level tennis and beating boys. That's about as good as it gets.
I love it. I can't believe they're 7 and 10.
I know. It's crazy, right?
Oh my goodness. Okay, so if you had to pick one thing to do outside of work, what's your activity of choice?
Yeah, it's playing with my family. So it's with my daughters and my wife. So if we can do things together at almost, regardless of almost what it is, whether it's athletics or whether it's downtime. I think being with the family is more important than anything else.
And what is the accomplishment in your lifetime that means the most to you, and why does it mean that much to you?
Can I break it into personal and professional?
Of course.
Yeah. So I think the personal piece is you hoping that you find your perfect soulmate, and so I did that. I think I'm the luckiest guy on the planet. So without that, you don't have children. So that the children are the greatest blessing after finding that perfect person that you can fall in love with every day, which I have. So that's to my wife and my kids. That's the greatest personal gratification. Professionally, I would say it's being chairman of the American Board of Surgery. I think it's pretty humbling to be elected by your peers, and they're all national leaders. And the issues and challenges within American surgical education and American surgery are pretty big. And so to have an opportunity to share a voice in that, I think is just one of the most unique experiences that anyone could possibly have. So those would be probably the two breakdowns of personal and professional.
Okay, so these are probably more clinical questions now. So if you had to pick one operation that you could do every day, and that's all you could do all day, what operation would you do and why?
I think that's probably a Latin distance. I love, it was an operation that we dissected the technical aspects of it in painstaking detail. We've written about it, published on it, we put it in the textbook. It also has a sentimental feel because it was the operation that triggered the textbook surgical pitfalls, and the residents were the ones that did it. So I think there's so from a point of being able to have someone learn how to do the operation and teaching and training it, and the gratification of somebody who ends up being symptom-free, who's can be pretty debilitated, it's a great operation.
Do you ever stop for a moment and consider the impact that you've had on our field of surgery? What's your perception of what this has been, or what do you hope it would be?
I don't have much time to think back and reflect. I probably should have been helping to do it, but to be honest, I really haven't. Sometimes I will go as a visiting professor someplace, and I'll see students that I had or residents that I had, and so that's where obviously you feel the impact most from decisions that they made that you may have helped influence in some way, shape, or form. But I don't really, I don't spend much time reflecting on those aspects, to be honest. I think, I look back very little. I look forward a lot. So I don't spend much time reflecting on the past.
What's your number one goal for change in surgical education over the next year, given your position, and why is this important?
I think the biggest goal is we've engendered, I think, almost universal agreement that residency redesign and re-engineering is important for a whole variety of reasons. I think for the next year is, and I only know this because John Hunter's now the chair of the board, and so I think that's the next 12 months, that's really the goal within the board. And then making sure that we have 100% agreement, not just a majority agreement, that this is the right direction to move forward with.
Okay. And is there anything on your bucket list in either your personal life or your career that you are willing to share that you haven't yet done but hope to?
Well, so my daughters, they've been to a lot of tennis matches, watched a lot of national players, but we've not been to the three major Grand Slams outside of this country, so to the French Open, Wimbledon, and Australian Open. So those are on our list. And the youngest one is 7, so she does international travel, but she probably, when she gets to double digits, will make those trips, I think. That sort of is on the personal side. I think, again, I'm just pretty much the luckiest guy I know. I think professionally, I've just had an incredibly fulfilled life. I do think within our healthcare system, we're working really hard, the highest quality, safest healthcare system in the country. And so if I can get to that point in the next 7 or 8 years with the team that we have, which is really world class, I want to be in a handful of the best healthcare systems in the country defined by that. So that's the next big goal.
Well, those are my questions, Dr. Evans. I really thank you for your time.